PADnet Tip, venous testing. Part 1, dorsiflexions. At the beginning of the test, after the cuff is inflated, the PADnet software will prompt the user to instruct the patient to begin their dorsiflexions. The correct way to perform a dorsiflexion is similar to using a kick drum. Have the patient keep their heel firmly on the floor, raising only the ball of their foot. A common problem is patients don't perform the exercise forcefully enough to evacuate the blood out of their limb. Remind the patient that this is a vigorous exercise and not a gentle foot tap. Some patients may have a hard time performing a dorsiflexion, and you may have to help them manually. That means you must help the patient raise only the ball of their foot 5 to 10 times to help evacuate the blood in that extremity. Part 2, selecting the refill time. After the patient has performed their dorsiflexions, the yellow highlight at the top should turn green and a refill trace will appear. Note that it is okay for patient's trace to go off the page. The goal is to stop the test once the trace has crossed the top red line or once the line has begun to plateau or flatten out, whichever has come first. Once the test has been stopped, you need to select the refill time. Begin making your selection by clicking once at the very bottom of the refill trace, as shown by the red arrow. Make your second and final click where the refill trace has crossed the top red line or has begun to flatten out, whichever has come first, as shown by the green arrow. After making both clicks, a blue highlight will appear and measure the refill time. Click Save, and then repeat on the next extremity.